Presbyopia Unlocked is an editorially independent podcast supported with advertising by Allergan. Treatment options for patients with advanced presbyopia are bountiful. But what options exist for those with mild symptoms who are not yet completely frustrated with their vision nor ready for surgical intervention? In this episode of Presbyopia Unlocked, experts discuss characteristics of these in-between patients and how they treat them and look ahead to new treatment options on the horizon. Coming up on this episode of Presbyopia Unlocked.
Hello, I'm Dr. David Goldman, a cornea, cataract, and refractive specialist out of Palm Beach Gardens, Florida, and I'm joined today by Dr. Selina McGee, founder, chief optometrist, executive and visionary Bespoke Vision, and Dr. David Geffen, director of optometric and refractive surgery services at the Gordon Shandlin New Vision Institute in San Diego. Today, we're going to be talking about the sort of in-between patients. And why don't we start with you, Dr. McGee? What are the characteristics of these in-between patients?
So, thank you for having me first. So, these in-between patients are the ones that typically are what I would describe as a mild, presbyope that is maybe not completely frustrated with their vision. And sometimes they don't even recognize that they're having an issue until we start to ask more pointed questions to them. And the other piece to that is a lot of these patients are, concerned with how they look, how they function at work. And because of all of our activities now and what we're doing at work and the visual demands that every person has, have just greatly increased, even pre-pandemic, but now certainly that has escalated. And the average person, is looking at a screen around 13 hours a day. That's an average. And so these in-between patients are the ones that typically haven't needed something. They've always just had what I would say is good vision. And they can certainly be frustrated and want more. And so that's kind of where this in-between patient falls.
Yes, another group of patients that I see quite a bit are patients who've had prior LASIK who feel that it's, sort of wearing off. Doc, I had LASIK 20 years ago, and all of a sudden I'm having trouble seeing up at the computer screen or reading. Can I just get a little touch up? And so it's tough because typically they're just not, a candidate at that point for a presbyopic IOL. We have a discussion about monovision, et cetera, but it's a really tough group to treat. Dr. Geffen, how are you treating these patients?
Yeah, it's really interesting because the pandemic has really brought to the forefront these in-between patients because of the extra hours of all this screen time. And many of our LASIK patients are coming in now. And like you said, David, they think their LASIK has worn off. Suddenly, doc, I was seeing great, but now I'm having eye strain at the computer and such. And it's a real difficult thing to deal with because these people paid a fair amount of money to go ahead and have surgery so they don't have to wear glasses. And then when I tell them that they need something for their computer or their reading, they're not very happy. And they look for alternatives. They're asking, is there a surgical technique that I can do? Can't I have more LASIK? And then we explain the limits of each type of surgery and try to come up with a solution that's palatable for these patients, including contact lenses. Sometimes we actually go back and do monovision LASIK with them. And they're too young for a clear lens extraction, so we don't like to do that on these in-between patients. But it's definitely an issue now, and it's the toughest patient is the refractive surgery patient in my mind, because they feel like they paid for this surgery and they don't want to have to ever wear glasses again.
Perfect. Dr. McGee, do you find certain advantages and disadvantages to these treatment modalities with these sort of in-between patients?
Sure. So, if we're talking about contact lenses, the The pro to that is it's non-invasive. It's something that we can fit every day. If you're talking about the refractive surgery patient, it can be a little bit of a challenge because they've got a flatter cornea now. And so a lot of our lenses that are coming out of a box are not going to work for that patient. And so we're getting into custom contact lenses. And, there's definitely cons to a contact lens because, especially with an emmetropic patient or someone that's post LASIK that has good distance vision, we're typically going to cause a little bit of a shift at distance where they're not quite as clear as they would like to be. So certainly pros and cons there, to contact lenses. And if you're, thinking about doing a corneal inlay, there's pros and cons to that with just surgery. And, we can dive into that topic a little bit deeper, but certainly pros and cons to contact lenses. But again, to recap, the pro is certainly non-invasive, straightforward. Cons are going to be there are limitations and there's visual compromise typically.
Yeah, with the corneal inlays, it's interesting that, the options have decreased. Obviously, the raindrop inlay was removed from the market. And with the camera inlay, although there are certainly successful patients, I think, and we'll get into this a little bit later in the discussion, but with some of these pharmacologic agents, we may have treatment modalities for these patients that don't involve the cost or the invasive aspect of surgery. Another option, of course, is laser refractive indexing, which I think will become more popular over time, but is not quite in the limelight yet. What do you think of some of these treatment options that are coming up on the horizon? And we can start with Dr. Geffen.
So there's a lot of new things that are coming to the marketplace. We have pharmacologic agents. Most of them are, pupil modulation approaches where they're using miotics. And as we did know with the camera inlay, if we create a small pupil, we get this depth of field that's really great. And for these in-between patients, this is a very good way to go because they only need one and a quarter diopters of plus to be able to function pretty well. So for them, these new agents are going to work well. There are some other agents that are corneal softening agents, and we fit the patient with a rigid contact lens to mold the cornea while the drug's being applied. And then once that's done, the cornea has reshaped for a temporary time, up to months, with these lenses. That's being worked on in Mexico right now. We have the lens pharmacologic agents, drugs that break the disulfide bonds within the lens matrix itself to make the lens more pliable and to add more of an accommodative effect. These types of drugs, I think the FDA will have a little more difficult time approving because when you start affecting collagen in the body, they're going to want lots and lots of studies. But we're very close to having approval for the miotics that are coming out. I expect that within the next 3 to 5 months, from what I've been hearing. And then there's also, many other surgeries such as the Refocus group that's trying to get approval. They've been up for panel approval for about a year now, and then they keep getting sent back for extra things. Our office has participated extensively in that study as my partner is the medical director for the company. And I've seen quite a number of these patients who've had the implants put in the sclera, and they do achieve a fair amount of accommodative effect. So that is another surgery worth investigating. So, and there's many more that are coming out.
Yeah, one technology that I find exciting on the horizon is softening the natural crystalline lens in the eye with laser. But typically when we talk about laser and the crystalline lens interacting, it's not leading to good outcomes. But hopefully, if that can be optimized to get more of a pre-presbyopic condition, would certainly be welcome and helpful. Dr. McGee, how do you feel that patient care, in your practice is adapting and changing as we have these expanding options for these early presbyopes?
So we are really intentional about how we talk to patients about presbyopia because of all of the things that we've been talking about tonight coming into the horizon. And like David said, we're going to have a miotic that's going to come to market in the next, probably maybe late December with pupil modulation. And so there's lots of excitement in this space. And there should be, because when you look at just the sheer numbers of who is suffering with presbyopia and the fact that we're living longer lives. So when you look at the fact that most people are going to live for 40 years with presbyopia, we need more options. And so we in our practice are really intentional about how we talk about presbyopia, and we have just worked on consistent messaging, because what I have found is as we talk to physicians across the country, a lot of physicians don't even use the word presbyopia. And so I think it's really important for all of us to be consistent in how we talk about this, because there are so many things coming into this space that are really going to help lots of patients, but especially this in between patient. And these in between patients, a lot of times, are not coming in for comprehensive eye care, because unfortunately, patients still think that because they see fine, and I'm using air quotes, that their eye is healthy. And so a lot of these patients don't have relationships with an optometrist or an ophthalmologist. And so for us to be really intentional for, these 31 million people that are wearing reading glasses, there's so much opportunity there to talk about this with people and talk about this with patients and share all of the things that come with comprehensive eye care. And so I think it's really important for the eye care community to be intentional about how we communicate what presbyopia is, why it's important to, have a good eye care physician in your arsenal, because we're going to be able to help even more in the upcoming months and years.
Yeah, absolutely. Excellent points. And, it's just a really exciting time that we have all these treatment modalities that will soon be available to meet the demands of these in early presbyopic patients. I just want to take this moment again to thank you, Dr. McGee and Dr. Geffen, for joining me today.